Okay, what we're going to do now is we're going to go after the scaling muscles. There's actually considered three scaling muscles: scaling anterior, scaling medius, and scaling posterior. And with the scaling muscles, technically they're transverse process of C4 through C6. So the way that you actually want to locate the scalenes is actually elevated. As you can see, the sternocleidomastoid kind of sticks up right here. So you're going to, for the scaling trigger points, you actually want to go underneath the sternocleidomastoid. Make sure it's always the posterior side. Make sure it's not the anterior side. And if you have a hard time finding the sternocleidomastoid, lift it up even more. As you can see, it'll stick it up. Also, you can have them contract that region too. So the insertion is the lateral surface of the second rib and also the first rib. So I'm just combining the scaling posterior, medius, and anterior together. So it will actually start in this region and go down to the first to second rib there. The action is it elevates first, second rib. So with breathing wise, it actually, if somebody has problems breathing, a lot of times they'll actually get really tight in that region. And there's actually a thing called thoracic outlet syndrome, and it can be the scalene muscles or the pec minor that could actually get impinged and actually shoot pain down the hand all the way to the last two fingers for the referral. But that's for nerve-wise, so the brachial plexus region right in here. So with the scaling trigger points, there's technically 6 of them. So you always want to make sure you go really slow. So always watch your reactions when you're actually performing this technique. So just go really slow. And actually communicate a little bit more with them too. So it's not like a Swedish massage where it's nice and relaxing. You're actually here for a purpose to try to get rid of their pain. So the referral for the muscle will actually go down to the thumb and index finger, and it can actually go to the posterior elbow region, also the pec region, and also back of the scapula region. So that's where the technical referral for the muscles is. So you can actually sometimes feel a ropey band right behind the sternocleidomastoid right here. So just go back and forth, and you can even have them kind of tense up their neck too. So try to bring their neck to the shoulder and kind of hold it to resist it. Sometimes you can actually feel that muscle kind of pop out at you then. But it's a very important muscle for breathing wise. So any muscles that attach to the ribs are considered breathing muscles. So make sure you concentrate on those then. So also with breathing problems too, it could be intercostal muscles. The intercostal muscles are in between the ribs. Those can actually get really tight too, so actually mimic breathing problems in those regions. So again, with the scaling muscles, just go really slow, because anything on the neck region, you just got to take a little bit slower. And if you ever feel any kind of a pulse at all, just make sure you do not press on that area then. And if you feel any round lumps, it could be lymph nodes, it could be calcium deposits. Of course, we can't diagnose, you don't know what it is, so just don't push on those regions for the scaling region. So again, for the referral, it will actually go down to the thumb and the index finger, so it should shoot all the way down there if it's actually muscle related. But if it is nerve related, it could be like thoracic outlet syndrome. It could actually go down to the pinky and a little bit of the ring finger. So just make sure you don't mix those two areas up then.